Representative Allen.
Thank you, Madam Chairman. Welcome back, Representative Jones. Mine really isn't a question, I guess, unless you have checked with the medical profession who will be prescribing this medicine and what their feelings are with prescribing something that has not gone through the rigorous type of evaluation and testing that any of our other prescription medicines have in determining long-term effects, the adverse reactions that can happen with this from individual to individual the same way it can with the general public with, say, Vioxx or any of the other medicines that we're familiar with?
Well, actually, the federal government is in the process. It is providing marijuana for medical purposes to patients. All the research is in, and marijuana has less side effects than most prescribed drugs that citizens throughout this country utilize presently. Marijuana is grown at the Federal Marijuana Research Garden at the University of Mississippi, and is processed and distributed by the Research Triangle Institute right over here. And patients receive the marijuana in monthly canisters of approximately 300 rolled cigarettes. I guess my point is, and this program was ended in 1989 because of the war on drugs, but those patients continue to receive it, and before they began to receive that, there was a major research by the federal government that indicated it was safe, useful drug.
Follow-up, Madam Chairman?
A brief follow-up, and we do have 5 speakers that want to comment, so if you could hold members could, we want to get around to everyone. Follow-up, Representative Allen.
I guess my concern is when you're talking about the government research, I've also done some research on research.
Do you have a question or is this a
Well,
comment?
it's kind of a comment on his assumption. I'm wondering, has there been because of the federal testing that this is such a helpful aid, has there been any direct movement towards getting authorization or acceptance by and licensing from FDA?
Well, as you well know, the FDA, just like our Department of Health and Human Services, their mandates come from the U.S. Congress, the President, etc. And so therefore there is some pending legislation presently allowing marijuana to be used nationwide for medical purposes. And also President Obama did issue an executive order indicating that rating these various dispensaries in states that have legalized marijuana for medical purpose would not be a part or a priority relative to his policies towards law enforcement.
Representative Farmer Butterfield, followed by Representative England.
I understand there are some other states that have this in effect. Are they incurring any problems?
No. Matter of fact, there are 2 bills that I have. One is for a referendum that has the exact same substance as far as the language and everything. In Michigan, last November, actually last year, the legislators in Michigan did not want to touch this. They thought it was too much of a hot potato, so to speak. So what they decided to do, they said, well, look, let's let the people decide. They'll vote it down. We won't have to deal with it. Well, the voters went to the polls last November, and Michigan is the 13th state, and voted it in by 63% of the voters. And now they're in the process of trying to implement it. But there are 13 states present, and there are 5 other states that have legislation pending, including North Carolina.
Representative England.
Thank you, Madam Chair. Follow-up to Representative Villa's comments. Representative Jones, you referred to the federal in several respects. Has the FDA done or are they doing their usual, quote, drug evaluation process for specifically marijuana?
Well, from my understanding, there are various research institutes that evaluate marijuana for other medical uses that haven't yet been determined. But the verdict is already out on marijuana being used for medical purposes and benefits. That's an undisputed fact. And I mean, I mean, all that information is out there. That's why you have 13 states, you have federal legislation, you have the presidential administration not really allowing state rights and allowing individuals who live in those states to use marijuana prescribed by a physician.
Representative Wilkins.
Thank you, Madam Chair. Our bill sponsor a moment ago said that the marijuana would have fewer side effects than many FDA-approved drugs. I was a reporter for 30 years, remember, and I've seen a lot about drug addiction and what it can do. And what I have observed in all too many cases is that there can be an acute addiction to marijuana, and it greatly affects family life. And so I would say that that certainly would be a side effect that we should consider. I think about it.
Thank you. If there are, if there are other questions from the committee, let's talk about them, but otherwise I'd like to start moving into the,
Let me respond to this quickly, 30 seconds, Representative. You're right about that. However, prescription drugs, my statement was accurate before. Marijuana is less harmful than many of the prescription drugs for cancer and all other types of disease. As you well know, there's an isolated small group of people get addicted to prescription drugs. Rush Lombard is a good example. But I'm just saying, and I'm not saying, this is not funny, there are other folks too, but people get addicted. That's just part of society, unfortunately, with alcohol, cigarettes, whatever. But you are going to have some of this. But this particular drug is less addictive by all the research than other drugs and many prescription drugs.
Representative Justice.
Thank you. I have 3 questions. I'll state them all out. What is a dispensary where you can buy this? And number 2, would it be a controlled substance?
No, it would be a
And
dispensary.
number 3, how could you not, if this is approved medical treatment, how could you deny it to people who are in a correctional facility?
Well, first of all, your physician, I'll answer your last question first. Your physician would deal with a patient in a correctional facility just like they do now. In other words, if a person has cancer and they're throwing up, they have nausea, I'm not a physician, but the physician may recommend that. Usually in a prison, though, when a person becomes deathly ill, they pretty much move them to the infirmary or whatever. Then answer the first question. A dispensary is just another word of saying that active drugs are going to the pharmacy store. In certain states, when it's controlled by the state, the dispensary would be located in the local county health department. So a person would go to pick up their marijuana by submitting the prescription from the doctor or the recommendation from the doctor. And in this bill, you can only get 2 months worth of supply relative to whatever the doctor recommends that's needed for your ailment.
And then you have one other question.
Is it a controlled substance?
Is it a controlled substance?
Presently, on the federal level, it is a controlled substance. It's a controlled substance, Schedule 1 felony in North Carolina. That's why we have this legislation to allow marijuana to be used for medical purposes.
Let me just say that there are a lot of painkillers that are used for medical purposes that are also controlled substances. So I'm assuming that it would still remain a controlled substance and that you could only get through a prescription.